Professor Kocabey for his talk about osseointegration, comparison in PTB and Kocabey press fit technique. Over to you, sir.
Osseointegration in Kocabey press fit technique. Why is it important osseointegration? Because ACL healing, two things important. One is osseointegration, second them ligamentation. Secure graft fixation with a proper femoral orthopedic tunnel is an important factor in ACL reconstruction, especially in the early postoperative period. A wider interface and closer contact is likely to lead to earlier bone plaque integration, but it is difficult to determine the period required for the graft bone to integrate into the tunnel postoperatively. There are two types of healing process for a bone plaque with the tunnel. One, indirect healing coronation tissue is generated between bone segments. Callus develops the gap between the bone segments, increases the neonatal bone, finally fills the gap. Second healing, direct healing, proceeds without generation of the callus at the boundary of bone absorption at the bone edge at the interface, with no gap forming in a stable mechanical environment. They believe earlier integration of the bone plaque to the tunnel accelerates the graft healing itself. Surgeons should pay attention to minimize extra space between the graft and the tunnel, or to maximize contact area between them. The last study from Pennsylvania in the mice and says that the compression is very important in the tunnel. What will we do it? We do it through graft fixation method we compare. One of them is bone plaque, bone tendon bone. We know that golden standard bone tendon bone with screw, and the other Kocabey press fit. 25 patients, bone patellar tendon bone used with screw, 25 patients, Kocabey press fit. This 1 day after surgery. This 10 millimeter, do you see here? Do you see 10 millimeter? These screw groups, please. After 6 weeks, 12 millimeter, the enlargement of the tunnel. Because there is empty of the tunnel, very important in here, there is empty in the synovial fluid here. That's why synovial fluid makes the enlargement of the tunnel. Before we say that, the bigger enlargement in the apertura, in the metaphysis. Why? Because synovial fluid in here. Biomechanical effect is okay, one-side effect or bungee effect for here enlargement. But synovial fluid, metaphysis side, it is a desired empty. And the problem for healing of the graft. You see here, 8 weeks, no any healing. In the bone tendon bone, we use the screw, the spongious bone is okay. The other side, cortical bone is okay, no healing. Just 2H, maybe healing. After 4 months, these good patients and almost healing is okay. Again, this time 40 millimeter. All patients, I can see that, 25 patients, I can see that after 2 months, 8 weeks, all of them, 20% or 40% enlargement of the tunnel. All of them, 25 patients has enlargement in the tunnel, 8 weeks, all patients. And the enlargement, big enlargement, the end of the tunnel, graft and screw. Very important point. In here, healing, please. 6 weeks, 6 months is okay in the bone patellar tendon bone. Another patient, please. Again, screw. These 2 months, again, almost 12 or 14 millimeter enlargement in again the tunnel. No healing. He said that in here, cortical bone, no healing in here. We say that bone patellar tendon bone is a golden standard. I don't think so. In his screw here, no healing, just maybe healing from here. 2 months, no healing, please. 4 months, this empty site, the upper of the bone and screw, you can see this screw here, spongious sites, contact with the screw, no healing. Cortical site, no healing. Just healing maybe here. 4 months, not complete, but healing is okay. But I cannot say almost okay. Yes, please. 6 months, Screw here. Healing is okay. 6 months healing is okay. How can you do it after 6 months after bone tendon bone using them? You can see the rehabilitation program. How can you use it? You can see no healing. Patellar tendon. In here, screw. Maybe here a little bit. Please. This another patient. Again, you can see here linking. 8 weeks no healing. Yes. Please. You can see it. 6 months healing is okay. Yes. Now Kocabey press fit. 5 weeks healing. 5 weeks. You can see here. PT, CT again here. Just 5 weeks. Very important point in here. And then maybe cortical side is not healing, but 50 or 60% healing in the 5 weeks. In cortical bone, cortical side, you can see in the cortical side, little bit not healing, but spongial side healing. You can see here like this. You can see it like this. 3.5 months, all of them is healing. I can do it, the rehabilitation program very fast. I can do it. Some problem in the femoral side, and I can see paid in the bone. I can do everything. 6 weeks leg hold. I can do it to my patient. Leg hold. Yes, please. 6 months. You can see it. To connect, healing. We did, I can say, 25 patients, and 25 patients, 50 patients. We did operate. One group, bone patellar tendon bone. One group, Kocabey press fit. Now we need, I think, 2 or 3 months finish the study. I have a lot of patients results. A lot of 2 months, 4 months, 6 months MRI tomography. 6 months contrast MRI. Now because I want to see that ligamentation of the patient, very important for me. But I can see osteointegration really Kocabey press fit very early. And the bone patellar tendon bone, we can say that golden standard, but one point in there, cortical bone, not healing. The other side we put the screw, not healing. Just healing, there is the edge of the bone plaque. Normally you say that the healing of the fracture 6 weeks. Why 6 weeks? Because there's compression. No compression, no healing. Very important point. That's why whatever you can do it, we must do it. Compression very important. Please. Another patient, you can see here. Again, Kocabey press fit, you can see here. Healing. Please another. Last slide. 3 months healing. But compression side, this cortical side, that's why healing is very slow. Thank you very much, everybody.